So we're ready to start. So just so you know a little bit about me, my name is Melissa Hale. I'm a licensed psychologist, and I work at the University of Miami in a couple of roles, really. One of the things that I do is I work at the Center for Autism and Related Disabilities, the CARD Center, and that allows me to interface with a lot of families and professionals who are providing services for kids with autism, adults with autism, and then also the families themselves. But then the other thing I do at the University of Miami, so my time is a little bit split, I work in a diagnostic and evaluation clinic called the Autism Spectrum Assessment Clinic, which is separate from CARD, although related in the sense that both organizations are intended to support individuals with autism. And so what I want to talk about today is clarify some of the processes by which individuals end up being diagnosed or labeled as having autism or an autism spectrum disorder. And then within those processes, clarify the distinction between what we consider to be a diagnosis, which is people often talk about my child is diagnosed with autism or have a family member diagnosed with autism, which has a kind of specific meaning, versus an eligibility. So depending on the process by which the features of autism were recognized, the autism spectrum disorder may be not so much a clinical diagnosis, but rather it might be an eligibility. So we're going to talk about what those two terms mean, and then how the different processes for establishing those two things, and then how that impacts access to services and treatments and so forth. And certainly if you have questions as I'm talking, feel free to either use the, or probably easiest to use the chat box at the bottom. You can simply type your question and I will see that and I'll be able to respond. Okay, so before we get into this, I just want to review, something that's very complex, but review it in a very simplistic way so that we're all on the same page. What we're talking about when we're talking about autism spectrum disorders. And there's still a lot about autism that we don't specifically know, but what we do know is that we believe it to be a complex developmental brain disorder, meaning that there's something neurologically that is presumably not working quite right, and we also know that there's a high incidence of autism. Right now, the most recent estimates that are coming out of the CDC, so these data were published in 2012, we're seeing that right now they're estimating 1 in 88 children meets criteria for autism, and that is even more prevalent in boys than girls. And also what we know about autism is that individuals who have autism are affected in a range of ways, and most prominently they're affected in the ways that they interact socially, in the ways that they communicate with other people, and then we also see some kind of repetitive behavior. So those are the characteristics that are shared among individuals who have that diagnosis or eligibility of autism. So we know it's a common disorder. We know that it affects development, and it affects development in specific ways. Now we also talk about autism being a spectrum disorder, and really all that means is that there's a varied way that the disorder presents. So individuals who are more severely affected can have severe limitations in those areas that we talked about. So in the area of communication, they might be completely nonverbal or have very limited language, have very little interest in socializing, and maybe have significant problem solving or intellectual difficulties as well. And then if we move around the spectrum, we see moderate levels of impairments, and then we also see at the higher end of the spectrum, we see individuals who still would be classified as having autism, yet the characteristics of their behavior patterns might be quite different from people who are severely affected, in the sense that they might have a lot of language and talk often, yet their would still be something awkward or unusual about the way that they use language that would be characteristic of an autism spectrum disorder. They may be interested in friends, so they may not be socially aloof so much, but there may be an awkwardness in terms of the way that they interact with other people that prevents them from being really successful in making meaningful or long-term reciprocal friendships. And intellectually, we even see people who are gifted, highly intelligent, who have characteristics of autism. So it is a spectrum disorder, and we talk about a spectrum disorder, meaning that an individual who meets criteria for autism, one individual who meets criteria for autism may look very, very different than another individual who meets criteria for autism, and oftentimes that's confusing because when we kind of have an idea of what autism is, it's hard to kind of generate a prototype of that in our heads because there is so much heterogeneity in the presentation. Okay, so how is this related to diagnosis? So here's what we know. At this point, and this actually comes, I think, as a surprise to some people who are, when they're first introduced to autism, is that we don't have any medical tests to detect autism. There's no reliable blood tests. There's no reliable genetic screens. There's no reliable brain scans. There's no, it's not part of the amniocentesis that a mother might get when she's pregnant. None of those things are effective or reliable at detecting autism. And so while we believe that autism is related to something going on in the brain that's not working quite right, at the same time we haven't specifically identified what those features of brain functioning are, and we don't have a good medical or biological test to detect autism. So what that means is that when we're classifying an individual as having autism, when we make it, when someone says your child has autism or this person has autism, they're not basing that on necessarily any kind of medical presentation, but they're basing that on their behavioral presentation. What are the behavior patterns that that individual is displaying or that their parents are reporting to have seen that are consistent with the characteristics that define the diagnosis of autism. And that's true for anybody making a diagnosis of autism, whether it's a physician or a neurologist or a psychologist or a psychiatrist. They're all making that diagnosis based upon the behavioral presentation of the individual client that they're looking at and their developmental history, so information that they might be getting from parents and teachers and previous therapists and so forth. So we talk about determining that a child has, and I'm using the term ASD here to refer to autism spectrum disorder. When we're talking about determining that an individual has an autism spectrum disorder, we're really talking about two primary mechanisms by which that gets established. And I'm going to go through these separately. But the first mechanism is some individuals have what's called a medical or clinical diagnosis of autism. And some individuals may also, or separately, or or alternatively, I guess rather, might have an educational eligibility of autism. So those are two different mechanisms by which kids are identified as having autism or an autism spectrum disorder. And those two mechanisms are not the same. And so understanding the distinction between those two mechanisms is useful in understanding how services are allocated and also what that means in terms of long-term planning and so forth. So let's talk first about a medical or clinical diagnosis. So a medical diagnosis or a clinical diagnosis, I'm going to use those two terms interchangeably, is a diagnosis that's made by some kind of professional outside of the school setting. And the professional who makes that diagnosis is typically someone who has some level of training on child development, on atypical development, has some knowledge specifically about autism and social communication disorders. And so typically that includes psychologists, neurologists, sometimes developmental pediatricians, sometimes psychiatrists. And all of those individuals, so long as they've had the appropriate focus in their training, would be qualified to make a medical or clinical diagnosis of an autism spectrum disorder. And the way that those individuals determine whether or not an individual has autism, we talk about meeting the criteria for autism. And what that means is that there is a set of standards, kind of guidelines, by which all of these clinicians use as their guide in determining whether or not an individual meets criteria for autism. And the standard by what they use is a book, and I'll show you more about this, called the DSM, the Diagnostic and Statistical Manual. So the DSM is not a book that's specific to autism. It's a book that's specific to a range of clinical mental health or psychiatric problems. And within that book, there are a specific set of criteria that are used to define autism. And so a psychologist or a neurologist, when they're interacting with a patient for whom they see developmental problems, they will utilize the criteria in this book, sort of go through it one by one and make a determination about whether or not the individual shows those specific characteristics. And if they meet the criteria based on the DSM, then they're comfortable assigning that clinical or medical diagnosis. And so when a psychologist or a neurologist makes a diagnosis of autism, so some families will go see a neurologist at the referral of their pediatrician, or some families will seek out a psychologist, for example. Once that diagnosis is established, so a psychologist writes in a report, this child has autism, that means the diagnosis is established and confirmed by a professional. Then that can help access some services. So for example, some insurances will cover services for kids who have autism or an autism spectrum disorder, but they'll only do so if that diagnosis is established. So if a parent were to call up their insurance company and say, I think my child has autism, he needs therapy, the insurance company say, well, you don't have a diagnosis yet. You need a professional to verify that he has autism, and then if that insurance company covers services for autism, that child would potentially be eligible for those services if someone covered that. And the same is true for some of the other mechanisms by which individuals, at least in our community, get services. So the Medicaid waiver, for example, serves individuals with a range of disabilities and disorders, not specifically autism, but one of the categories that they serve is autism, autism spectrum disorders. Excuse me. Apologize for that. And so in order to access those services through the Medicaid waiver with a diagnosis of autism, the diagnosis has to have been established. So I just want to bring this up because we're kind of in a transition period with regards to the DSM. So when I mentioned that there was a textbook that clinicians use to determine whether or not someone meets the criteria, right now we are in the 4th edition of the DSM. So there have been several previous editions, and the 4th edition has actually been revised a little bit. That's what this TR stands for, text revision. So this book was published in 2000, which makes it a little bit outdated right now. We're at right now 13 years past this publication, and things have evolved in the past 13 years. So even though this is the book that we're utilizing right now, we're due for an update. So in terms of the way things are outlined in the DSM-IV, so this is our current guideline, this is what is the most current publication right now. Autism is described by the terminology pervasive developmental disorders, which doesn't sound like autism in terms of those language, but it really refers to autism. So when people talk about pervasive developmental disorders, that term is somewhat interchangeable with autism spectrum disorders. It's just the kind of technical terminology for what the DSM uses. So these are the pervasive developmental disorders or the autism spectrum disorders. And in the DSM-IV right now, the TR version, we actually have 5 different disorders, clinical disorders, that fall under the umbrella of pervasive developmental disorder or autism spectrum disorders. And I'm not going to go into these in detail, but just so you know, there's Rett's disorder, childhood disintegrative disorder, autistic disorder, which is one that's commonly that we hear a lot about. A lot of times people will just refer to it as autism, but commonly the more technical term is autistic disorder. There is a not otherwise specified category, meaning that there's this kind of catch-all category within the autism spectrum when a child doesn't really meet criteria for these other categories, but still shows enough symptoms of autism, we can diagnose a disorder called pervasive developmental disorder, NOS, or not otherwise specified. And then there's the Asperger's disorder, which is a clinical diagnosis right now within the autism spectrum. So I said we're in a kind of a transition period, and the reason I put this slide in here is because we're anticipating that in May of 2013, which is very, very close to where we are right now, depending on when you're watching this video, we are expecting a new and updated version of the DSM. And so all of what we're expecting to happen, and so we're gonna move to the DSM-V, and we have a pretty good idea of what's going to be in there. When we move to the DSM-V, this term pervasive developmental disorder is going to go away, and we're going to replace it with the term autism spectrum disorders. So that's one of the changes that we'll see. But the other big change that we're going to see is that all of these distinct categories of diagnosis are actually going to go away as well. And we're going to clump them all together into one, well, not all of them, but most of them together into a one unified category called autism spectrum disorders. So we're no longer going to be making a clinical distinction if everything goes as we expect it to go when this gets published, and I don't anticipate any changes. We're no longer going to make the distinction between autistic disorder and Asperger's disorder and PDD-NOS. If an individual meets criteria for an autism spectrum disorder, we're just going to call it autism spectrum disorder. And so that's going to be what the clinicians, the neurologists, psychologists, all of those individuals are using as their terminology. So again, we know it's going to be a fairly heterogeneous group of individuals, right? That we're still going to have that spectrum that we talked about in terms of presentation. There'll be individuals with a very intense clinical therapeutic needs, and there'll be individuals who have, are much higher functioning that will still meet criteria for an autism spectrum disorder, but we'll just use this one term to refer to all of those individuals. Okay, so I said there's 2 mechanisms. That's the medical or clinical mechanism, but there's the other mechanism by which many individuals are identified as having autism or an autism spectrum disorder is through an educational eligibility, which is different. So an educational eligibility of autism or an autism spectrum disorder is something that is a process that's completed through the public school system. And so it's part of, rather than having criteria based on the Diagnostic and Statistical Manual, the DSM, or criteria based on things that psychiatrists or psychologists have established, it's based on criteria established by educational law. And so the educational law has clarified, and they do this, educational law does this because by law, individual children who have special learning needs and special developmental needs are eligible to receive special education services through the school. And so there have been laws in place that explain which kids are eligible to receive those services. So simply having a medical diagnosis of autism, so just because a neurologist says your child has autism, does not automatically mean that that child meets the educational law criteria for receiving special education services. Most of the time, those things overlap. But there are cases by which a child may have an established diagnosis from a private medical provider or psychologist, but not have an educational eligibility of the same disorder. So they may not have ASD eligibility within the school. And partly that's because there's two different criteria. There's the DSM criteria for medical diagnoses, and there's the educational criteria for determining whether or not a child meets criteria for special education services. So within the school-based eligibility, we already see that there are not specific categories the way there are right now in the DSM-IV. So in the school-based eligibility, we already don't make the distinction between Asperger's disorder, autism, or PDD-NOS. In the school-based eligibility, all of those individuals who show those characteristics are already clumped into a category of autism spectrum disorder. So in some ways, the way the school's doing it is going to be more closely aligned with what's going to happen in the DSM-V. And we're going to be talking across both mechanisms about children who have autism spectrum disorder. Of course, with educational law, we're talking about children up to age 22. With clinical diagnoses, this can be made throughout the lifespan. And so the reason that an educational eligibility is important for access to services is that once a child is deemed eligible, and it doesn't have to be autism spectrum disorder, there are other eligibilities in the school system, but once a child is deemed eligible, meaning that they meet the criteria, the educational law criteria for having an autism spectrum disorder, now the school can move forward in putting in place special education services. So, for example, the school may determine that a child has an autism spectrum disorder, and then they may develop an individualized education plan, an IEP, that provides more specialized, targeted services on an individually tailored manner for that child to better access the curriculum. So, but an IEP team or the school team is not making a medical diagnosis. So just because a family has a educational eligibility of autism, they would not necessarily be able to call their insurance company and access outside services to be covered by insurance if they don't also have a medical diagnosis. I see someone here has a question. We have a participant typing in a question, so I'm going to pause for a minute and give her a chance to do that. So our participant is, and this is a good question and one that comes up often, um, and we just type in the age of your child as well. She's describing that her child received an educational eligibility before she had a clinical diagnosis on the autism spectrum. And when they did his educational planning, they didn't identify that he met the educational law criteria for autism, but instead said that he met the educational law criteria for a separate eligibility, language impaired, which is an eligibility in the school. So there are a number of eligibilities that kids might have, and that kind of goes along with this next slide as well. So the school did their evaluation, and I'm just summing up here what I believe to be true, and at some point said your child meets criteria for a language impairment and is now currently receiving services in school with that eligibility. And then at some point, maybe you saw another professional, a neurologist or psychologist who said, we see features of autism or an autism spectrum disorder, and so that exceeds what you might find in just a language impairment. So in addition to language impairments, a psychologist neurologist is saying, well, I also see social impairments. I also see some repetitive or behavior restricted interests, and so rather than just clinically calling it a language disorder, I see features of autism. So now this, there's a parent who has two discrepant kind of diagnoses or eligibilities. So she has a clinical diagnosis of an autism spectrum disorder and an educational eligibility of language impaired. And this is not uncommon. And so if you look through these bullet points, you can see that there's a range of ways that these can go together, either be equivalent, like tethered together, and you have both. So some kids do have an ASD diagnosis and an ASD eligibility at school. Some kids can have an ASD diagnosis, but have been doing so okay in school that the school hasn't even deemed them eligible under anything. And maybe they don't have an IEP. You might have a child who has a diagnosis of autism, so a medical diagnosis, and a school eligibility of something else. So this is what this example is, and I'll answer your question more carefully in a minute. You might see an individual has a school eligibility of ASD, so they have an IEP, they have a specialized school program, but no medical professional has ever said that they have an autism spectrum disorder. And then you also see these cases where school eligibility of ASD, but maybe a medical diagnosis of something else, like obsessive compulsive disorder, ADHD. So her real question is, should she go back and try to alter the IEP and change that eligibility? And I'd have to answer that on an individual case, but I can tell you that in some ways, it partly depends on the individual child's, and it partly depends on the availability of school programs as well. So when a child is receiving services at school, things that a child with ASD might receive at school based on their eligibility, they oftentimes will receive speech and language therapy at school because communication is one of the core deficits in autism. But if your child is deemed eligible under language impaired, I'm assuming that he's probably getting language therapy as well. Some kids are eligible to receive classroom consultation from an autism support specialist in the district. And so that's not every child with autism, but there are cases of children in the district whereby the teacher gets regular consultation from an autism specialist. That's only provided for kids who have an autism spectrum disorder eligibility on their IEP. So if that's a service that your child would need or benefit from in order to access the curriculum, having that language impaired eligibility isn't going to allow the school to provide that specialized ASD support. other things. Some kids are able to or require special autism classrooms where the teachers are specifically trained in autism spectrum disorders, and they're using very autism specific instructional strategies. And in those cases, if a child would benefit from those kinds of services, they can only access those if they have the educational eligibility of ASD. So part of it, depends on what your individual educational needs are for your child. If he's with a language impaired eligibility and his educational needs are being met with that eligibility, there may not be any real meaningful benefit of going to get further and pushing forward to get the ASD eligibility at school. But on the other hand, sometimes it does enable the school to provide additional services. So, and so that's something you can always consider. And when they do the original eligibility, so some children are deemed eligible under language impaired or autism, and sometimes that happens very early on, sometimes it happens later. That's not permanent. I mean, sometimes people think that's part of their permanent record, and it is part of their permanent school record, but it doesn't mean that it can't ever be removed or altered. So lots of kids are deemed language impaired at some point, and then later on the IEP team, they might do a reevaluation or they might get additional information, and the team says, it's clear to us now that there are features of autism there, and so we would like to change that eligibility. And for young kids, very young kids who are 6 and under, a lot of them are served with an eligibility of a kind of a general label of developmental delay. And the school uses that eligibility term early on because a lot of times the developmental trajectory of kids is hard to always know. So there may be kids that they suspect might have autism, but they're not 100% sure. And so they might just utilize the eligibility of developmental delay to say, we recognize that they need services, and once they get older, we'll be able to more clearly target what those exact needs are. By 6, kids can't have a developmental delay on their IEP anymore. So kids at that point have to be reevaluated, and either they have, made sufficient progress that they no longer qualify for educational services, but more often they will be reclassified as something else, ASD, language impaired, something else. Someone's asking me a question. So this will be archived and available. Someone's asking me a question about how to access this recording later. They have to leave, and it will be recorded. Okay, so we talked about the clinical diagnosis of an autism spectrum disorder, and so just to go a little bit further into how that diagnosis is made. I mean, we talked about the DSM and the DSM criteria, and that's done by a psychologist. So typically the way individuals end up at the psychologist's office or the neurologist's office usually comes from some kind of referral. And that referral can come from anywhere, really. A parent might initiate it, say, I have concerns about my child, I want to seek a professional to look at him or her. A lot of times the pediatrician will say to the parent, as part of their regular baby visit, I'd like you to see a specialist just so we can see if there are any developmental areas that are outside of normal and that we want to target. So the referral for a further evaluation can come from a range of places. Like I said, they utilize the criteria based on the DSM, and I've omitted the specific criteria, but they're looking for at least 2 impairments, and there's a list, and from that list, the diagnosing person would have to find at least 2 impairments in the area of social interaction, at least 2 impairments in the area of communication. I'm sorry, at least one impairment in the area of communication, and then at least some restricted or repetitive behaviors. That's the criteria that we have right now. But how that gets determined varies significantly across clinicians or service providers. So, sometimes I hear parents say, he was in the neurologist's office for 15 minutes and they told me he had autism. How could they possibly know in that short amount of time? And that's a fair question. So sometimes that evaluation process is done very quickly. So a neurologist might sit down and interact with a child and get a sense that there are notable social interaction impairments or notable communication impairments. They might also I'm sorry, I'm reading a question. So they might also ask the parents for information, and so based on that report, we'll be able to make a determination about whether or not the individual meets that DSM criteria. I'm sorry, I'm going to answer a question. So someone's asking me specifically about how to get this later. So if you go onto the UM-Card website, umcard.org, there will be a link there where you can access not just this card find, but other pre-recorded card finds. So I'm not sure how quickly they get posted, but I know it won't take too long. Now, in addition to those kind of quick and checklisty, quick overview type evaluations that you might find by some clinicians will do a much more comprehensive evaluation that typically gets done by a psychologist. And at our psychology office, we do comprehensive batteries of evaluation where we sit down with parents for several hours, sit down with the kids for several hours, and look at not just the features of autism that might be reported by the parents, but then we go through and look at features that we see through comprehensive and more long-term. Right, this is the ASD clinic interactions with kids, and then we also look at other things, intellectual assessment, their everyday behavior functioning, and so forth. But the goal of that is not just to establish a diagnosis. I mean, the goal of that is to really develop a more targeted treatment plan. But a lot of times kids will get their first clinical diagnosis through a comprehensive psychological evaluation. And then the diagnosis is specified. This is based on the DSM-IV, and the DSM-V we will probably be just using autism spectrum disorder. And so that's a little bit different than the process for establishing an ASD eligibility in the school. So the way the ASD eligibility is established in the school, first there's a referral, and again that referral can come from a number of places, but it's usually either parent initiated or teacher initiated. So a parent says to the school, I want my child to be evaluated by a school psychologist because I can see that there are some clear difficulties that he or she is having with regards to social interactions and communication, and I'm worried about that affecting his schoolwork. Or sometimes it's teacher initiated. So a teacher might say to a parent, I want to refer your child to the school psychologist for an evaluation because I'm concerned about the way he's or she is functioning in school. So once that evaluation gets initiated, it's the first part is conducted by a school psychologist, and then oftentimes there are other players involved, like speech pathologists perhaps. And so the parts of the evaluation that are required by Florida law, so there's some kind of documented behavioral observation. That means somebody has to go in and watch that child within the context of their current classroom and observe their social behavior, their academic behavior, and so forth. So that has to be conducted. So it can't just be based on a teacher saying he's having a hard time. Somebody has to include an actual behavioral observation as part of the evaluation. Somebody has to do a comprehensive social and developmental history, looking at asking the family questions about were there any prenatal complications, were there, are there any significant head injuries or anything else that might explain why these behavioral concerns are present, to help make a determination about whether or not that behavior pattern is consistent with autism or some other educational eligibility. A complete psychological evaluation. So initially they have to look at cognitive skills and features of autism and academic skills and so forth. That's where the school psychologist role is to do that in an individualized, using standardized testing. So that's done. It's not based on just their grades, but it's done on a one-on-one testing session with a school psychologist. And then a speech pathologist, if the referral question is centers around any kind of language problems or suspicions of an autism spectrum disorder, then a speech and language evaluation has to be done. Now, some families come into the school and they already have a clinical diagnosis. So they have a neurologist or somebody who said, my child has autism. And so parents can bring that information to the school, and they really should bring that information to the school so long as they think it's a appropriate representation of their child. The school, so long as that information is provided by a licensed person, a licensed physician or a licensed psychologist, it can't be, your neighbor down the street who thinks your child might have autism. But if it's a diagnosis that's provided by a licensed professional, then the school shall consider it. Doesn't mean the school has to provide the same diagnosis or eligibility as the diagnosis that you have. So if you bring in a note from a neurologist that says my child has an autism spectrum disorder, it doesn't necessarily mean that the school has to adopt an ASD eligibility. The school has to, by law, consider that as a possibility. So once they are done with their evaluation, here are the criteria by which they determine a child meets the educational eligibility for an autism spectrum disorder. So the psychologist and the assessment team, the speech pathologist, will evaluate all these characteristics, and then they will bring this information back to the school team. So one of the criteria is that the child is showing an uneven developmental profile, meaning that there are some things the child is better at, but significantly so, and things that they are significantly weaker at. So commonly with regards to autism, it's not uncommon for us to see kids who are very good at visual problem solving, maybe good at puzzles, reading maps, things like that, but have a hard time communicating. And so that would be, that's just one profile. That's not characteristic of all kids with autism, but that certainly is an uneven profile, right? Something about that developmental progression is developed unevenly. This is not a criteria in the DSM. This is unique to just the school eligibility. And so kids who have very even developmental profiles wouldn't necessarily meet educational eligibility for an ASD. These are more linked to what we see in the DSM. Some impairment in social interaction, some impairment in communication skills, and you'll see across both clinical diagnoses and educational abilities reference to both verbal and nonverbal language. So verbal language is how well we use our spoken language to communicate, but we also take into consideration nonverbal communication. So things like utilizing eye contact to modulate interaction. So if someone's talking at you but they're not ever looking at you, that makes for an awkward communication interaction, or which is probably how you feel about me right now, because it's hard to look at the webcam while I'm talking about slides that are below. But also using your gestures to communicate. So we're looking at how kids, if I say, what is it? Or I don't know, or all of those kind of ways that we use our bodies to communicate are fall under that umbrella of communication skills. And so if those are impaired or deficient, that would be part of the educational criteria and the diagnostic criteria. And then we're looking for any kind of repetitive behavior or stereotype behavior, and that's a pretty big category of behavioral presentation. So that might be repetitive motor mannerisms like spinning in circles or hand flapping. It might also be restricted interests, so an over focus on certain topics like maybe electricity or Civil War history or something like that, but to the point that it is unusually obsessive. And so in order to deem a child ASD in the school, they have to meet those criteria. That's that one part of a two-part test. But then you also have to verify that as a result of those problems, those characteristics, the child needs special education or related services. Now, this doesn't mean that the child has to be failing, so they don't have to get all F's on their report card before we say a child needs special education or related services. I mean, that's a fairly subjective criteria. But if we see indicators that the child is not understanding the social rules of the classroom well, or that they're not able to communicate effectively in their written expression or their verbal expression, or the things that are common in individuals with autism spectrum disorders, and they meet those educational criteria that are specified by law, then the team can say, yes, we feel comfortable assigning an educational eligibility of an autism spectrum disorder. So the eligibility part comes first. The team says, yes, we think this child is eligible for meeting criteria, educational eligibility of an ASD, but that's just the first part of the service provision process. So after that they are deemed eligible, then the school team will meet together and start to generate a plan about what educational services, special education services the child needs. And that's done typically through an individualized education plan, an IEP. Now keep in mind that that plan is individualized. So just having ASD as an eligibility does not mean that a child has to go into an ASD classroom, does not mean that they have to have a certain curriculum. The eligibility itself doesn't dictate anything about the programming necessarily. It just highlights that child's educational needs, that there are areas that need to be supplemented with additional instruction, primarily communication and socialization, and appropriate interaction with materials in a non-repetitive way, and so forth. So there are lots of kids with ASD eligibilities on their IEP who are in a range of classroom settings. Some of them are in gifted classroom settings, some of them are in regular education settings, some are in specialized programs for kids with autism, and some of them flip between different classes throughout their school day. So simply having ASD on your IEP does not dictate what services or what classroom a child gets. It doesn't. What it does dictate is that we want to focus our educational goals on the areas of communication and socialization, and of course anything else that is affected by those deficits. Does that make sense? So are there any questions about the process for diagnosis and eligibility? Any additional questions? So the main distinction is that we want to be clear that the ASD eligibility is part of the school process, and that's how a child accesses things like an individual education plan and specialized services at school. And a clinical diagnosis is something that's done outside of the school system, and that would be what kids need in order to access perhaps therapies that are covered by their insurance or other service providers like the Medicaid waiver, for example. And so that understanding that distinction can help guide some of the treatment planning and understanding how to access those things. Now with CARD, the Center for Autism and Related Disabilities, they don't make a distinction between educational eligibility and clinical diagnosis with regards to who's eligible for CARD services. So an individual who has a documented ASD by any mechanism, school or private, is eligible for CARD services. And even kids who are younger than 5 and younger, who may not have it documented, but there are documented developmental delays in the areas associated with autism, so language impairment or some documented um, repetitive behavior, even without a confirmed diagnosis, are still eligible for card services, because we know that there are so many kids out there who have features of autism and may eventually receive a diagnosis of autism, but maybe have not yet um, met formal criteria through the educational system, or have not yet been identified through a physician or a provider. So those kids are still eligible for card services, and once they turn 5, then we require an actual diagnosis or eligibility of ASD, but either is fine to retain card services. So someone again is asking me if the slides will be available after the webinar. So the webinar will be recorded and it will be posted on the card website to go back and watch. And I said before, and I'm not sure how quickly that happens, but it shouldn't be a long time. And just the last thing, the National Research Council, and again, this is a little bit old as well, talks about what are the kinds of things that are priority areas of intervention for individuals with autism. And so, when we're talking about building an individualized education plan, or even thinking about private therapeutic services, we have to recognize that individuals with autism oftentimes need systematic instruction and intervention in areas that are not typically systematically taught in school. So even beyond just reading and writing and mathematics, the therapeutic goals and even some of the educational goals should focus on other areas of need, like communication skills or social skills instruction, play skills, and so forth. Okay. Does anyone else have any questions about the content? So someone's asking, would the clinical diagnosis help with the IEP development, or is it